Are you ready for open enrollment and all of the insurance changes that may have gone into effect for your specific plan? I am a registered nurse and I give tips for insurance, mostly focused on Medicare, how to advocate for yourself in the United States healthcare system, as well as home health tips. Follow me for more tips and advocacy for you or your loved one. Most of you know there have been some significant changes recently, and this will probably impact your insurance to some level or another. And so I just want everyone to do their research and be ready to make the decision on your healthcare insurance coming up, especially when it comes to Medicare, which the open enrollment period, whether it is original Medicare or a managed care plan, does come on October 15th and goes through December 7th. Managed care can work a little bit different depending on the state that you're in. For example, in the state of Florida, you can change your managed care plan up to 120 days after you start a new plan. So this is why there's those predatory people who call and get your loved ones to change their insurance, because you can just kind of hop around within those insurances, which can cause some significant issues, which I've done videos on before. Medicare managed care plans are managed by insurance companies. They are not managed by the government. So any changes that are happening within a specific healthcare company will also impact the managed care plan. For example, there's been some significant changes with Cigna and how they are billing and coding certain doctors' visits. I can give more information on it, but the point is I would not be surprised if many providers stopped taking Cigna. So watch that, be aware of that. Speak to your doctor if you really like them to make sure that they will be continuing to take Cigna. There's also been a lot of changes within United Healthcare, so there's that as well to watch. People like to argue with me that the big beautiful bill hasn't gone into effect yet, so therefore there haven't been changes. Yes, there have. Yes, there have, because the managed care plans and original Medicaid, listen, it's all about money. So they're not going to wait for a lot of these impacts of the big beautiful bill, whether it's Medicaid or Medicare, to go into effect before they start cutting, right? They're going to plan for the changes and they're going to start cutting now. So you have to do your research. Just look at the benefits some of them offer, because, okay, you get this much over-the-counter benefits, and you need to think about other things besides that, because with your HMOs, you're going to need to get authorization from your primary care doctor in order to be able to see specialists, etc. PPOs, maybe they're more expensive, but you do have more freedom to choose your providers. And then with original Medicare, you need to make sure that you are having the Medigap plans to go along with them. So the point of this post is, I can go into more detail, is to start thinking about your insurance changes now. And maybe, okay, fine, you love what you have now, but are there changes coming? Research and make sure that you are ready and you take the opportunity coming up in open enrollment period to make any changes that are going to be best for you or your loved one and the coverage of your health care. Guys, it's getting worse and worse. They're covering less and less. And we have to be proactive in making sure that we have what we need and do the research necessary to protect yourself and your loved one.